Good morning, everybody. Let's please take our seats and get ready for our meeting. We're already a couple minutes late. I don't like to be late. Okay, good morning, Yolanda. We're going to call the meeting to order.
Yeah.
You're right here on the end. I know, it's taken by a bunch of other guys now. Well, good morning. Welcome to the February 2020 PPACG meeting. I'm glad to see all of you. The first thing we're going to do is establish a quorum. Whose job is that? Okay. And the next thing we're going to do is go around the room and introduce ourselves. I will start. I'm Jill Gabler from Colorado Springs. We'll go on the left, so you can.
Dick Elsner, Park County.
Sharon Thompson, City Fountain.
Andy Gunning, PPACG.
John Graham, Manchester Springs.
Ron Jeffrey, Director of Staff, Schriever Air Force Base, 50 Space Wing.
Melissa Porter, Air Force Academy.
TJ Fryer, I'm representing Lieutenant or Colonel Falzerano for the 21st Space Wing at Peterson.
Tyler Stevens, Green Mountain Falls.
Turner Smith, Town of Rama.
Norm State, Teller County.
Danny Pico, Colorado Springs.
Glenn Havener, Town of Palmer Lake.
Your turn, Yolanda.
Yolanda Avila, Colorado Springs.
Thank you. Welcome, everybody. Welcome to everybody in the audience today. We have quite a group, which brings us to our next item, public comments. Is there anyone here who would like, excuse me, to speak to us in public comments today for items that are not on our agenda? Anyone? Oh. Good morning. And while we're here, while we're waiting, let's introduce the people coming in right now. Go ahead, Cammie.
Cammie Bremer, El Paso County.
Thank you. Sorry, Karen.
Karen Rowe, Region 2 RTD.
Good morning, ladies.
CDOT.
Good morning.
Good morning.
I'm Jolene Hausman, Executive Director of Fountain Valley Senior Center, and I just wanted to come to the board meeting today and thank you guys greatly for doing the carryover funds the way that you did them this year. It really helps the nonprofits be able to expend the funds way less hectically at the end of the fiscal year and in a much more well thought out manner. So thank you so much. We greatly appreciate it.
Great. Thank you so much for speaking up, Jolene. I appreciate you being here. Anyone else like to speak in public comments before we move on? Okay. The next item on the agenda is consent items. There are 3 items listed here: the approval of our minutes, summary of financials, and membership. Would anybody like to call something off, or I would appreciate a motion to approve? Norm? Thank you. Norm, and then I guess we'll take Yolanda. All those in favor, please say aye. Aye. Any nays? Motion approved. On to number 5, informational items. The first item listed is the regional safety presentation.
And Jason O'Brien,
Right.
one of our transportation planners, is going to take that one.
Good morning, Jason.
Good morning, thank you. Got a little PowerPoint for you this morning.
Can you make sure you're on, Jason? We can't hear you.
Thank you. So I want to talk to you briefly this morning about regional traffic safety. Around the middle of last year, we started taking a closer look as a regional agency at regional traffic safety, and took a couple of approaches to that. One was, of course, some at-the-desk research into some facts and figures. The other was that we did a series of informational interviews. We wanted to talk to some folks more expert than ourselves, so we reached out, had these interviews with some planners, couple different flavors of engineer, law enforcement, people in public relations, education, communication, just to try to round out our own picture and educate ourselves as to what's going on with regional traffic safety. And what we'd like to do this morning is just kind of share with you some of the things that we learned as we educated ourselves, and hopefully lay some groundwork for a couple things that we'd like to do. The reason for doing this now would be that trends and driver behavior have been changing in the state and the region, and we'd just like to get a grip on that, handle on that, especially because the overall trend the past few years is that traffic safety has been worsening, and severe crashes have been increasing faster than increases in population, so that's of some concern to many of us, I know. We'd like to engage with traffic safety as a regional organization, and part of our interview process was to figure out how we could do that efficiently and appropriately, being supportive while avoiding duplication, and maybe get involved in doing some little bit of direct action in improving regional traffic safety. So along with that, maybe dispelling some myths as well. Starting on the high level, where Colorado stands in the larger picture of the U.S., you can see we're about in the middle, ranked number 25th. This is as of 2016. 1.17 fatalities per million vehicle miles traveled. Sorry if that's a little small. And that's pretty close to average for the nation. So nobody can really shake their finger and say we're doing so terrible. But at the same time, the best state had fewer than half of the fatalities per million vehicle miles traveled. So while we're not doing poorly compared to our other states, there's still a lot of room for improvement. And we're definitely nowhere near that point of diminishing returns for safety. There's still a lot we could do. Is this too small? Are you able to see this well enough? This is an overall graph, a 20-year trend, fatalities in the state of Colorado. You can see there was a low point around 2011, and then a spike up around 2017, 2018, and that's where we are, even though there has been a reduction as of last year, 2019. And the red line at the top is increase in vehicle miles traveled. I want to talk about seatbelt law, and the reason I want to talk about it is because when we were conducting our interview process, everybody talked to us about it. Everybody mentioned it. So just not to take a stand on either side of what our laws are, but just to faithfully report what we were told by our experts. Colorado law does require front seat passengers and vehicle occupants to wear a seatbelt. However, it's a secondary law, which means you cannot be pulled over for this. You can only be cited for failing to wear a seatbelt if you've been pulled over for something else. It is a primary law for child passengers under 15. In states where this is an issue, where there's a push for a primary law, there's some typical arguments that do emerge. Some of the typical arguments against are diminishing returns, that if you've got 89% of your drivers and passengers wearing seatbelts, and those 11 or 12% left over at the end are just not going to do it. They're that hard-to-reach percentage. Another argument against tends to be Fourth Amendment rights, which is search and seizure. There's some fear among some groups that this law could be abused. The argument for is a lot more simple. There's a demonstrated record of saving lives. A lot of states that have passed primary seatbelt laws have their before and after snapshots, and there's always been a significant improvement in reducing serious injuries and fatalities. As a footnote, there also tends to be that reduced cost to the public in terms of traffic delay, investigation, and other costs. This is just a brief picture for you. I'm not going to go over this whole thing, but what's happening in the United States as far as seatbelt laws. If it's too small to read, the red areas are where there's primary enforcement. Yellow and orange are secondary or mixed enforcement, and it looks like it's just New Hampshire that doesn't have a law related to seatbelts. That's right. This is just for your reference. As we go forward, some of the facts and figures I talk about are going to be from Region 2, and that's our CDOT engineering subregion. It's the Lavender area right here. And Pikes Peak area and Pueblo are the center of population in that region, so they have a heavy influence on the statistics. But I just wanted to show that to you because that's what we'll be talking about for some of this. This is a quick snapshot of Region 2. I won't go through it, but just want to point out that it tends to follow what's happening in the state at large. There's that big spike in 2018. This is a breakdown for statewide versus just El Paso and Teller County. You can see that statewide and just in the Pikes Peak region, serious crashes have gone up quite a bit, fatalities have gone up quite a bit, and that's compared to the 2010 to 2014 five-year average. But it's gone up quite a bit faster in our Pikes Peak region, by almost 70% versus just a little over 30% statewide. What I'd like to do for a few minutes now that we've looked at some high-level what's going on with crash numbers overall is unpack it a little bit and just look at it from some different angles and say and look at what's happening to who, what types of crashes are occurring, what are the causal factors. So one thing to look at is time of year. A lot of people might think because of hazardous conditions in wintertime that that's when most of our fatalities are happening, but it looks like the opposite is true. It's during the summer months that we're getting the peak in fatalities. Urban versus rural areas, they're quite different. These bars make it appear that there's the same number of accidents, but there are actually a lot more fatalities in urban areas, but the per mile traveled fatalities are more than twice as bad in rural areas. So very different. The orange and gray here are the serious injuries and fatalities. So greater numbers in urban areas, but a greater rate of severe crashes in rural areas. So this might be some myth busting for some people. We like to point the finger at the kids, 15 to 19, high schoolers don't know what they're doing. They just got their license, getting in all these terrible crashes. Not true, actually. Looks like the only age range where there's a disproportionately large number of severe crashes for the population is 20 to 39. So these are mature, experienced, able-bodied drivers that are behind a lot of this. No. And older folks, too. Sometimes they get the blame, but it looks like definitely not true. These are just some figures that jumped out as we were doing our research. From 2012 to 2018, motorcyclist fatalities up by 30%. 3% of vehicles, but 16% of fatalities. 9 times out of 10, the motorcyclist was at fault. So there's a behavior issue going on here. Bicycle and bicycle fatalities, this is statewide, were mostly steady between 2008 and 2017. But pedestrian fatalities statewide more than doubled. So if you like percentages, that's over a 100% increase in pedestrian fatalities. Hopefully this isn't too small. Causal factors for fatalities. This is actually for Region 2. This is our region. These are the things that are going on. You can see improper turn is a big one. Failure to yield right away. Speeding together, exceeded lawful speed, exceeded safe speed. That's over 20% together. But after all the time and attention it's gotten, driving under the influence of alcohol, still the single leading causal factor of fatal crashes in our region. A couple other little things that jumped out that were interesting, not to downplay it, but distracted driving crashes, many of these. So not to play it down, it's a big problem. But in 2018, nobody died in distracted driving crashes. Again, another statistic relating to age, we love to blame the 16 to 20-year-olds. They're inexperienced, they don't know what they're doing. But actually it's 25 to 29-year-olds that are the biggest 5-year age category getting fatal crashes. 16 to 20-year-olds are among the lowest percent of drivers for fatal crashes. And so we've talked about causal factors, who's involved, what's going on, but what's the actual most common fatal event? What's the most fatal crash type we're experiencing in Region 2? It's not intersection crashes, it's not rollovers or anything else. It's roadway departure, vehicles leaving the road. That's the number one type of fatal incident that's happening. Talk a little bit about what some other people are saying and doing about regional safety. I'm not going to go over all these in the interest of time, but there are some people who say that autonomous and connected vehicles are going to come and take all our safety problems away. And experts agree that they absolutely will, but not anytime soon. Not anytime soon. The industry is moving away from full autonomy right now, actually toward a very gradual approach to increasing driver assistance functions in vehicles. And even when there is autonomy and casual use, there's going to be a mixed fleet of traditional autonomous vehicles for a long time. So our safety problems being solved by autonomy could be half a century away, potentially. It could be a very long time. Some plans and initiatives that we became aware of as we were educating ourselves about regional safety. It's hard to be supportive of our members and initiatives when we haven't made ourselves aware of what they are. Colorado Springs Police Department, who we've been talking with, has made improving traffic safety their number one strategic goal. El Paso County received a pretty healthy-sized grant to do a traffic safety audit and plan, and that's going to be kicking off in the next few months. We talked to El Paso County Sheriff's Department, who, among other things, is going to start using some advanced technology to improve traffic safety. We talked about the reduction of traffic deaths in 2019 in our region, CDOT Region 2, and that was just by broadly increasing the focus on safety. After talking with them, they said no magic bullet, just increased focus on safety across the board. And Drive Smart Colorado is also very active in our region, and I just want to give you a quick snapshot of what they do because they're a pretty incredible organization, very expert, highly knowledgeable. They know everybody, and they're very active. They educate everybody from junior high schoolers to law enforcement officers. We had a chance to participate in the State Transportation Safety Plan, which was completed mostly last year. I think it's supposed to be formally adopted fairly soon, in the next couple of months. Draft is completed. They had a huge stakeholder process, did a lot of interviews, a lot of consultation with many experts, planners, engineers, law enforcement, health and environment, you name it. They were able to classify all the input they got into these 4 basic categories. These are what people think is happening right now with traffic safety. So we've got high-risk behavior, vulnerable roadway users, severe crash mitigation, which is infrastructure-related, it's engineering, and programmatic, which is how can we reorganize what we do to avoid serious crashes. But the one that we heard the most about by far, and the element that people felt was really out of control, was high-risk behavior. So we talked with a lot of engineering folks, locally, regionally, and statewide, and their opinion is that we have basically a handle on the engineering problems that are going on. We basically know what they are. We have there's usually a process in place for making these engineering improvements, and there's a budget, never enough, but they've got funds, but it's in hand, and the part that people really feel is out of control and increasing all the time is high-risk behavior. Briefly, what do we have and what can we do here? We do have some very rich crash data from CDOT and the Department of Revenue, a lot of detail about what happened, who was involved, cause and effect type of crash. The big drawback right now is that the location information is not very exact. So if one of our members, for example, wanted a report on what types of crashes did we have and how many in our jurisdiction in the last 2 years, or however many years you're interested in, we could do that. But if the question was more specific about what intersection treatment should we do and exactly where, that might be a little bit less reliable because the location information isn't very precise. We can make it more precise, but it's labor intensive and it would represent a pretty big commitment. And even then it wouldn't be perfect, just better. Safety is already part of our planning and our transportation improvement program process. These are our core products, our plan and our tip. We do look at level of safety service when ourselves and our committees are looking at or evaluating projects for funding prioritization. Safety factors in the last round, the last long-range plan, received a weight of 13.5%. So a project score when it was being evaluated for funding was 13.5% weighted by its safety score. And we do have federally required performance measures and safety targets, although as we've discussed, currently they're fairly modest and not very aspirational. But there's nothing about that as a footnote about safety targets. There's nothing in that that prevents us from doing more in other areas if we want to. So I've referenced the stakeholder informational interviews that we've done, talking to our law enforcement, planners, engineers, people in public relations and education. As we were having these conversations, there were some common themes that emerged, things that everybody said or nearly everybody said. First is that there's some great work already going on, so PPACG should not reinvent the wheel. We should figure out how to engage and support and partner. Our engineering folks have said we really need to see if we can assist our members in getting GPS-located crash data, which is the one great aspect of the data that we don't have. Again, high-risk behavior. People who are in traffic safety are just frankly frightened by this right now. It's the element that seems to be always increasing and just out of control to pretty much everybody. Technology solutions like signal timing, automated enforcement, fully aware that they can be controversial, but just faithfully reporting what our traffic safety experts have told us, that those are worth exploring. Everybody mentioned driver distraction, seatbelt use. And there was quite a bit of mention of just a lack of general knowledge of some of our existing safety efforts, something that our own members are already doing, and that some kind of regular report, maybe to this board, would be very much appreciated by a lot of people doing safety work. The number one best way that was identified in this process for PPACG to engage directly was to do some kind of a safety education awareness campaign. And that goes back to the high-risk behavior again. High-risk behavior is basically where our safety practitioners and experts say, we've got other stuff in hand, but please help us with this somehow. Nobody really has a handle on this. So that's something we'd like to do, probably engage a company or nonprofit more expert at this than we are to execute the campaign. And in some capacity to partner with Drive Smart Colorado, just because they're involved with everything and they're very, very expert and they know everybody. They're very well connected. And just real quick, their board composition is law enforcement from several of our members are engaged on their board. They have public relations, communications, and marketing folks, school districts. So they're just very well positioned to be of assistance in this if we can partner with them in some way. Don't know what that would look like yet. Going back real quick to doing some kind of regular safety update, possibly on a rotating basis. If this board is interested, we would like to bring that to you in some form, perhaps quarterly, biannually, something like that, and maybe on a rotating basis. This is just the idea right now, have some of our regional safety practitioners come in and give an update on what they're doing, where they need help, what's working, what's not working, things like that, if there's an interest. There's some head nodding. And then these are just some potential future topics. But I do want to ask, sort of informally right now, is there an interest in doing something like that? We'll say quarterly for the moment. Comments or interest?
So I can't speak for everybody, but I think this is one of the most important issues for us as far as safety. So I'm not sure I agree with some of these, but in general, I think we should have the conversation about those issues.
Okay.
And others? Andy?
Jill.
Okay. Yes, Yolanda. Go ahead.
Jason, so when you say these are the three
Oh,
people,
You want me to read them?
yeah, it would really be helpful to me because I have no idea what's up there.
Yeah, let me read them real quick. One is micromobility, for example, e-scooters. One is signal timing, automated enforcement, for example, traffic light cameras, and another is connected and autonomous vehicles. And these, I guess, are just examples. We don't need to do these.
We could
but-
figure out what topics are
Yeah.
most crucial for us. Andy?
Yeah, thanks for the brief. It was pretty informative. Can we get these slides? Because we're not in our packet, so.
Definitely.
Yeah, really good. I have a couple questions if we're...
Yeah. If I can make one quick
Okay, go
comment,
ahead.
a caveat, while you're, when you have these slides, one thing that comes up sometimes is, with a lot of this data, is the same statistic might look different from one presentation to another presentation, and a lot of time what's behind that is different data years. So just be aware of that. Someone might see a 5-year average that's 12% for something, and that's for 2014 to 2018, and someone else might have a different figure, same statistic, but it's for 2013 to 17. So it may look like it's inconsistent, but it's just different data years. So just bear it in mind.
Okay.
Sorry to interrupt.
We won't pick it apart. Okay. So you mentioned the number one reason why for deaths was leaving the road.
Yeah.
What does that mean?
It means the vehicle leaves the road and hits a fixed object.
Hits a fixed object.
Off-
So that
comes
leads
off
into
the
my
road.
second question. You said that there were no deaths that were associated with distracted driving,
Mm-hmm.
and yet why does somebody leave the road? I would suggest that, can they prove that it wasn't distracted driving? And I know in Colorado Springs, we had some pedestrian and cyclist deaths that it's inconclusive. The drivers even acknowledged that they had been using a device somewhere around that time and could be distracted. So, I mean, how can they actually say definitively that no deaths were caused by distracted driving, when it seems to me that probably the majority of them are?
Yeah, it's possible, and it's all I can do is tell you the source. I mean, it's just data from police reports. So it's as accurate as those get. Police
Okay.
reports go to the Department of Revenue, which goes to CDOT, which comes back to us. So
Okay.
that's your source.
And then my last comment, sorry, this is my topic. When it comes to aggressive driving, it seemed like the number one suggestion was to educate and try to help people understand how bad that is. And I don't necessarily disagree with that, although I think that there's really good data that the physical design of our roadways would strongly contribute to whether or not someone speeds and is distracted. If the road is narrow and there's a lot of bump outs, for instance, and a lot of stop signs, people are forced to pay more attention. So, I mean, I don't necessarily agree that it's just all human talking to people. We have to actually physically change our roads to encourage people to drive slower and pay attention.
There is a lot of support for that, yes.
Okay. Other comments, questions? Go ahead. I don't either.
So you talked about distracted driving versus DUI, and that the largest group was the 25 to 29-year-old set.
Yeah.
How are those DUI deaths or accidents broken out between driving under the influence of alcohol versus driving under the influence of marijuana?
I don't know, but I can find out for you.
I would like to know that, absolutely. I would like to know, since we've legalized marijuana, how much has accidents risen with that?
I don't have the data on hand, but I can tell you that from our conversations with law enforcement, they're quite frustrated by it. Because, for example, one thing that law enforcement brought up is that people think that they're fine when they're high on marijuana. They think they're not affected the same way that they are on alcohol, and they're wrong, that it does affect their performance driving.
But according to the slides that you're going to give us in the data, your
Yeah.
marijuana data is under driving under the influence or driving distracted?
Let me find out for you.
Okay.
Okay.
Andy?
We had a pretty good discussion with our chief of police on some of this data, and to answer that question, it's very complicated to get the marijuana test, and so what they'll do, the cops will stop as soon as they get something to get them on, and generally speaking, if they're driving under the influence of marijuana, they're also driving under the influence of alcohol, and so they just don't do the test because it takes time to get the results back, and it's a very expensive test. So anecdotally, unfortunately, we don't have very solid data to back it, but anecdotally, they said it's 100%. That those are under, okay, let me back up on that. He said 100% of the fatal accidents had marijuana involved. Now, that was an anecdotal statement made by our chief of police. Have no data to back it. But the issue about getting the test and being able to conclusively define that, they just don't do it because they get them on alcohol first.
Sure. Turner?
Thank you. Joe, I'm 100% with you when you say that leaving the roadway and distracted driving go hand in hand. I don't buy into the idea that those two are not tied together. And I think they need to go back and look harder at the accidents that they have, and they need to examine it harder in the future when they're investigating those accidents that occur, and see if they can come up with more information when they're doing investigations in the future to see if they can make a tie-in between distracted driving and fatalities. Because I think the information is there, and I think they will be able to prove that out. And I think Jill's completely right on this one, and it needs to be addressed.
Okay.
Maybe more than reported. Okay.
Copy.
Yeah,
Thank
that's
you,
something we
Turner.
can look into.
Go ahead, Norm.
Thanks. So moving, the number of people who are educated and still do bad things is probably, foregone conclusion.
Exactly.
Who doesn't know that smoking is bad, yet there are people still smoking on the planet. So simply educating does not create change of behavior. So we're moving now from a physical science of what kind of engineering and curves and sight distances from the physical sciences into social sciences. Maybe we need to add psychiatrists to the staff. Andrew, I don't know.
I don't think we can afford that.
No, really. But my point is that we're heading into a whole new area of behavior. And I think I saw something similar to Jason. This is a great presentation. But there's another slide that was a comparison of how many accidents are caused by traffic road design versus driver behavior.
Right.
And the ratio is probably 20 to 1. Right. Driver behavior is the fault. We know how to build good roads.
No, we don't.
We can put engineers to work on that, but we can't design good people.
Amen.
Okay.
So I'm curious to where we'd like to go on that, the social sciences field.
I can tell you that with safety education awareness campaigns and that we know of, they pop up here and there. The state will do them, a local jurisdiction will do them, a school will do them, and that they tend to have before and after snapshots. Like law enforcement will keep these snapshots of what was it like before, what was it like after, and they tend to get some pretty good bounce when they're happening. The problem is that they're not sustained and they're not done in an organized way. They just sort of pop up like mushrooms here and there, and they're there for a little while, and then they're gone. So what we'd like to try to do is to just do it in a more organized and sustained way. And I personally don't know exactly what form it would take. We would be relying on an organization like Drive Smart Colorado who does this a lot, and they're quite expert at it. But we can absolutely bring more information and ask some more questions about preferences in terms of what exact shape would this take. And if we were to do it, I'd also want to ask if there's anybody here who would prefer to be involved in that effort too. So that may be a little bit of a long-winded answer, but they do tend to get pretty good bounce statistically, but it just doesn't last very long. So it would need to be done in a more sustained way.
If forget or we have a different people who move through the traffic zone different times of day. Different person?
Yeah.
Oh, it is, okay.
Right, okay. I have a couple more questions up here. Sharon?
I was just wondering if anybody had thought of or researched a correlation between the drastic increase in the homeless population and the huge increase in pedestrian safety.
Yes. Yeah.
Okay.
And that's actually something that Drive Smart has been trying to do, is organize a pedestrian safety campaign for homeless, because that's definitely
I've had them
something
walk
that's
out in
been
front of the
happening.
street in front of my car when you're,
Yeah.
so.
That's a thing, yeah.
And I too had the DUI question with the alcohol, and Andy answered it, once they have them on alcohol, they're not going to test for the pot. And so people who are really an advocate of that can still go around and say, nobody's been killed by pot. And we know anecdotally, I have seen studies where up to 50% of the people are admitting they're driving, while they know they're under the influence of it. So, and then my one last question was, we in Fountain jokingly say the military community is what keeps us young down there, because we got a lot of retired people. And I noticed that the military community was not one of your partners in this. And I was wondering about, in further studies, potentially including some of the military police or somebody from their organizations, because I think it's important to know what they're doing to engage, because since that age group that was the highest, the 20 to 29, is one of your prime age groups that you have in the military. So I'd love to know what they're doing and how we could incorporate it, how we can include them a little bit better in our trainings and things that we're doing out in the community, because like we said, we jokingly say they keep us young, but at Fort Carson, when they come home, does get a little impacted and people get a little bit more impatient, and so, we as a community, it's always important that we know they're coming home, so we kind of know, but they need to know when they're coming back in the community. It takes us a couple weeks to all settle out to the new traffic patterns of everybody being home, so, but.
Good point. Dick?
Yep. When you talked about the region, you said El Paso County and Teller County. Was that all of Teller County? Or
Yes, all of Teller County is part of Region 2. It's a large region.
No. On some of your statistics, you said, you looked at Teller County and El Paso County.
Oh, yes.
I'm kind of curious, why didn't you include Park County? And that's why I asked, in your study, did you take all of Teller County when you dove down into the data, or did you just take the area that's part of your transportation region? I mean, the local one, the Colorado Springs one. And if you took all of Teller County, why don't you expand that to Park County? Because we don't have as many accidents, but if you look at them, we do have probably the most dangerous stretch of highway in the state of Colorado. And it's just a few miles around Fairplay where we've had 4 or 5 fatal accidents in the last couple of years. So, I would like to see, because Park County is part of PPACG, I would love to see Park County included in some of your studies.
Absolutely.
Thank you.
And I will comment on something slightly unrelated. We've got our Tri-County study coming up, and Park County will be heavily involved in that. And to answer your question about the data in this case, that was actually not part of a study that we conducted. That was found data, i.e. we stole it from our state partners because that was the data that they had when we wanted this type of data.
Smart.
Okay.
Thank you, Jason. Anything
Thank you.
else? Anything else from the group? Okay. Yeah,
Yeah,
this is
so
great.
thank you for Jason for getting this organized. So we are going to bring forward probably quarterly updates. We've talked about bringing in maybe Miley from the Drive Smart group and maybe some public safety, law enforcement folks to get firsthand background of what they're dealing with as well. So really appreciate this. We've been a little bit absent from this conversation, but now that we're
Great.
back to full staff, we feel we really need to engage. I hate to say it's a public health emergency, but it's getting really
important.
serious out there. So,
I'm
so
glad.
thank you.
Glad to hear that. Thank you, Andy. And thank you, Jason.
Thank you.
Our next item for information is the Unified Planning Work Program mid-cycle update. John? Good morning, John.
Good morning. So, Madam Chair, members of the board, for those of you who are relatively new to the board, the Unified Work Program is basically our contract, for lack of a better term, with our federal funding partners, FTA, Federal Transit Administration, and FHWA, Federal Highway Administration. Basically, it sets out the funds that we receive, how are we going to use those funds administratively, and what program we're going to do. So the UPWP is done every 2 years. Those of you who have been on the board a while might remember that you adopted it last year. So this is the time of the 2-year cycle where we come with updates. And so really it's the same document, and what we're going to do is have some corrections, edits into that document, as well as update the financial numbers. So this is the first part of the process where I'm just going to briefly chat with you about the contracts that are associated with it, make sure that we're sort of continuing to spend your money within the region the way you would like. Next month, Catherine will come back and she'll chat about the actual document itself. You should have, hopefully I'm not over-promising, Catherine, but you'll have a little bit of a markup showing the text changes. It'll come through that next month as a draft, and then hopefully, knock wood, that everything moves forward, and then we'll come back the month after that, which I believe would be April, asking you for the adoption. So think of this as step one of a three-step process. So as far as the budget items, I don't need to sort of, I think we'll save some time here that we might have lost earlier, just to say that it's in your memo, kind of going over what we're spending money on, data acquisition, software to do our modeling, both the land use and the travel demand, as well as website support and other data and expertise. The one thing I do want to point out is that to follow up on Jason's point, we have money set aside for some sort of safety campaign. Now, it's under sort of a generic safety element, because if we have a jurisdiction that needs to purchase a safety software, Diaxis was the one that we've used in the region before, but it could be another type. We're not locked into any specific brand name because we have to go through an open procurement process. If a jurisdiction needs help purchasing that, part of the money can go to that, but the rest of it is available for some sort of public education campaign that, again, we would bring back to you. You can adopt the UPWP talking about having the money available, but that doesn't automatically give us the authorization to go ahead and start spending it. So we'll need to bring back to you an additional item after the UPWP that says, this is our recommendation. And it could be our recommendation saying, hey, we think Drive Smart Colorado has a great program. They just need more funding to do it, and we'd like to set aside X dollars to do that. But that would be an additional agenda item at a different time. Having it in the UPWP merely just sets aside the funding and makes it possible to come back later with that item. And again, based on your input, it might not be that, it could be something different, but again, it allows us to do that. And so with that, I'm happy to answer any questions, or if not, have it so Catherine is set up for next month.
Great, thank you, John. Any questions from the board? Okay, very thorough, appreciate it. Next item is the AAA carryover. I'm assuming that's Jody. Good morning, Jody.
Thank you, Madam Chair, members of the board. Thank you for being here today. I just wanted to provide an update to the carryover process. This is the federal funding that comes back to us that was unused in the previous year. And for those of you who are new, I'm new too. I started at the end of September, and one of the areas that I started looking at was efficiencies in our processes, and I was challenged by this board to find a way to get these monies out to the community as soon as possible. So that conversation was in November. We looked at our processes, expectations, estimates from our fantastic finance manager, realizing that those estimates were down to the penny, which meant that's probably better than an estimate. And so we looked at our internal processes, kicked off the RFP process to our current providers. That's how the carryover process works, that those funds are only available to current providers. We solicited that carryover RFP in December. By the time I came to the board, you can see there in the summary, by the time I came to the board on January 8th, we had received the carryover, the formal option letter from the state on January 7th, and it was indeed right to the penny. And so January we spent with our technical review subcommittee of the RAC board, completing the review of the carryover funding requests. They finalized those requests, made those recommendations. The RAC approved those recommendations on the 23rd of January, and we were able to finalize those distribution award letters. And because of the process, expedited process, and creating those efficiencies, the carryover funds are in use right now. They were made available February 1st, and so we will see the first billing cycle out in March. So those funds have to be used by June 30th. So there's also in your packet the final RAC distribution. And so if you have any questions about those, I'm happy to answer that. We did have, as I had mentioned, at one of the last board meetings, we had $636,030.81 to provide to direct services, and all of those monies were used. We had a total requests of $941,110.79 requested. We were able to put into place a total of $734,781.35. A portion of that is admin specific that cannot be distributed to outside providers, so that stays here. And so 636 and change was distributed to outside providers.
Okay. Questions from the board? Great presentation, Jody.
Thank you.
Okay, our last item for information today is an update on the Specialized Transportation Services Coordination. Who is
Madam
leading
Chair,
that?
I'll take that.
Okay.
And I may need some help. May call a lifeline on Jody or John, and no Craig from MMT and his staff are here as well. Just wanted to take a couple of minutes to get you up to speed on discussions we've had around specialized transportation coordination throughout the region. A little bit of context at first. I think you can consider this basically a transit service that's provided throughout the region. MMT obviously is our primary transit service provider for our fixed route bus system, and also for our paratransit system for folks with disabilities that can't get access to our fixed route transit service. And then this is maybe another subset of transit where it's designed for seniors, people with disabilities, and others with mobility challenges. We've provided support through PPACG for senior and specialized transportation through our AAA funding allocation process. And I think some of the carry forward funds that were approved last month that Jody just reported on were part of that as well. But historically, we've supported a number of service providers in the region, Silver Key, Envita, Fountain Valley Senior Center, and others to provide rides to seniors. MMT has provided that same basic service, but with different fund sources. They've administered our PPRTA funds that flow through MMT for that service as well. And they're also the designated recipient of the federal transit grant known as 5310. That's a section of the federal code where it's described. But they administer those funds as well, basically to the same service providers and a couple others. We were approached at PPACG a couple of months ago, back in August, I believe, about the possibility of consolidating the distribution of those funds under one umbrella, and namely under PPACG. I thought it made sense to start exploring this concept, given our role in the AAA, especially since we provide that service to seniors. I know I alluded to it just really briefly when we put our budget together and brought that forward to the board back in the fall, our budget and our work plan. Because I know we had set aside a position that's not fully funded yet, but have a position in our budget for 2020 to serve in a mobility coordination fashion. The idea at that time was we'd have to find outside funding to fund that position, and namely funding through FDA if we were going to fill that position. But in that time, over the past couple of months, me and my team, John and Jody and Mark Northrup and Casey, our finance manager, we've been doing basically our due diligence process and looking at what this would look like if we took this in-house under PPACG, and have had some fantastic conversations. We've been talking with FTA. They've got an office in Denver, folks we work very closely with, CDOT and their Transit Services Division. Great discussions with MMT, the current coordinator of the federal funds. Also with our service providers, Silver Key, Envita, and Fountain Valley Senior Center. And We also had some really fruitful discussions with DRCOG, the Denver Regional Council of Governments, and our North Front Range MPO partners up in Willett and Larimer County. DRCOG is a really timely and relevant example because they've just gone through this process to consolidate all those funds under their umbrella, and they're going to administer those through their AAA. DRCOG, after a couple of years of going through this process, finally got approval from their board back in December to submit a letter to the governor to become the official designated recipient of those federal transit funds. And I understand that that's now been approved as well. So DRCOG has already assumed those responsibilities that we're exploring right now. So we've got a really great test case, if you will, to really learn from as we kind of go through this process. So we can learn from our...
Can I ask a question?
Yes.
So for DRCOG, are they providing that service for the entire RTD boundary? It's, I think, within DRCOG?
Good question. I think it's beyond the it's within the urbanized area, but it may go beyond that. And this is where it gets a little bit murky, and we're still trying to get our arms around this. We provide service through the AAA through all three counties, basically, but funds that we get for the 5310 grant are limited to the urbanized area, I believe. But then there's other monies that CDOT can make available outside the urbanized area for the same service. So DRCOG, not looking for a head nod or suggestions. I think they are grappling with that same thing since they are a AAA and then also provide that MPO support. So for me, it's making sense that we continue down this path, but I also want to keep the board up to speed and give you a chance to ask questions and tap the brakes if we need to tap the brakes. For me, it's got to make sense on a number of different levels. First of all, it's got to work for us as an organization. You know, it's got to fit within our mission, which I think it does, especially given our AAA support that we provide for senior transportation. And it's also got to be something that we can support organizationally and have the resources to be able to stand up. And I think we could with one addition for that staff position. I'll come back to that in just a minute. So it's got to work for us as an organization. Secondly, it's got to make sense as far as the public funds that we're using to administer this service. You know, the AAA funds that we provide, the PPRTA and 5310 funds. You know, this needs to be an efficient way to use those public funds to get those out to our service providers. And I think there are some efficiencies that we could gain by getting these funds basically under one umbrella. And thirdly, finally, you know, it's got to work for the ultimate riders and the users of the system. I'm really encouraged by the conversations we've been having with the service providers, where they're really working very closely to build a new kind of a common database where they can use to manage the rides and the demand that they're seeing out there in the community. So I'm heartened by that. That gives me kind of peace of mind that with the way the service providers are working together, I can see a path forward where this is going to help the ultimate users of the system as well. So I'm feeling comfortable with those three different kind of categories that I kind of broke out in my mind. And feeling really good. We get great, like I mentioned, really good support from MMT as well. Great feedback as far as all the things that we need to get in place as an organization to be ready for this responsibility if it does ultimately happen with approval by the board and the designation by the governor. So in my mind, it makes sense to keep moving forward down this path. There's a couple of specific kind of next steps that I think would be part of this. One of them is engaging more, maybe more publicly with our committees, our committee structure, and have that conversation with the folks that would be involved in this process. That would involve discussions with the TAC, and actually we've got our FTA rep coming down next week to meet with our technical advisory committee, the transportation experts around the table. Engaging with the RAC that distributes our AAA funds so they understand what their role might be in this process as we distribute those funds. The mobility coordinating council committee that we have as well, they're going to be involved with this as well. So I want to start reaching out to those committees and getting them up to speed as far as what this would look like and maybe start charting out a process for how we would manage those funding sources using the committee structure that we have in place already. So that's one aspect of the next steps. Other next step is that we need to move forward with filling that mobility coordinator position. And we can do that by seeking FTA funding, working with MMT to put in a request for those 5310 funds. I understand that may require a letter of intent that we're indeed moving forward down this path, which we're in conversations with MMT about right now. But before we get that position filled, I don't think that we can make a lot of other progress in putting together all the documentation that we would need, that FTA would need. charting out what our process would look like as far as how we would distribute those funds, AAA, PPRTA, and 5310 funds. There's just a lot of stuff we need to put in place that FDA is going to want to see, and I would want to see before we take that leap, that we need a dedicated person to really be able to chart out and piece together. So with that, we'd be happy to answer any questions. I haven't seen any major red flags that cause me concern. I think this really does make sense for the region. I think it really does fit in with our overall mission, and I feel good about this approach.
I feel good about the approach, too. I like the process and the steps you're taking, so just keep us up to date.
Yeah.
Turner, sir.
Thank you, Chairman. Andy, jumping right over the horse to the carriage, how long would it be until you would approach the governor's office?
That's a really good question. Probably in several months. It's a couple of steps down the road. I would want to get that position filled, initially engage with committees, make sure we get that position on board and start putting together all the documentation and the process materials that we would need. And as we start charting that out, have to figure out the right timing, but probably a little bit later this year, maybe by the summer, would come back to the board to see about getting a resolution passed where the board would authorize us to submit a letter to the governor to become the designated recipient of those funds. I know MMT would like to see us, move forward, fairly quickly and try to get this wrapped up by the end of this year. That may be doable, but again, it's contingent on when we get a position on board that can really start doing the heavy lifting. So some of this stuff is going to work in parallel. So probably, I'd say, in several months, we'd be back for that approval to move forward once we feel comfortable enough with the process that we have in place.
Are there back channel discussions with the governor's office about what you're doing in the meantime?
I wouldn't characterize it as back channel. We're working directly with CDOT staff and FTA staff, and I think if they're supportive, then I don't imagine that the governor's office would have a problem with that. If they know that we've got our ducks in a row and we've been working with the right partners, I don't think that would be a difficult approval.
I have a few people who want to talk. I'm going to start with Yolanda, just because she's right here.
Thank you, Madam Chair. Andy, I think that this is a great process that you've been engaging in for a while as one that has used the specialized transit. And I think it's great that it could come under PPACG, and I really do support the idea of getting someone to spearhead that and get a paid employee to do that. So I thank you for all of your work, and I think it's just really going to put clarity in this whole situation, and the specialized transit persons will be able to go to this one person or this one agency and get things really settled and lined up to really serve the population that desperately needs it.
Thank you, Yolanda. Andy?
Thank you. Yeah, we kind of started a little bit of this a few years back when we just tried to coordinate a single, we tried to help set up a single coordinating agency who could just make the calls. That turned out to be a extraordinarily complex, and I don't know that we ever solved all the problems with this. I think this is a great step, but just, the note of caution that it is a lot more complicated trying to get all those different agencies with the different pots of money and the limitations that come with those money. Just trying to get a single database. So you made the comment that you're making the single database, and that was probably the biggest obstruction that we found because they couldn't share the data because of some of the restrictions. So I think it's a great effort to go down there. I think this is probably the way to get over all those barriers and hurdles. Following Dr. Cogg's lead, however much it pains me to say we're going to follow Denver, but
they can make all the mistakes.
They can make all the mistakes. We'll let them face plant all along the way, and we can step over the carcass. So great effort. I support moving forward on that.
I know.
But just, I think it's a lot more complicated than most people realize.
I'm going to go to Cammie next. If you're not using your mic, can you please turn it off? Thanks.
Thank you.
You're off, Yolanda.
I just wanted to, I'm assuming that that the process of presenting to us today is maybe also going to the PPRTA board as well, given the transit 10%.
It will, but it's not going to go this afternoon, but I need to get that scheduled sooner rather than later. Yes. Good
But
observation.
eventually,
Yeah, that's part of the
before it
plan.
comes back to us for final approval, it will have kind of gone through their process as well.
Yes.
Yeah.
Yep.
Good
to know.
point.
I would echo Andy's comments that this is, I'm staring at a communities working together sign across the back of all of your heads there, and this is a perfect example of how we can better serve the larger community by being smart with this. So
Right.
thanks for the work on it.
Thank you, Cammie. Norm?
This is the one ride concept returning? Is that the characterization or no? The one ride concept was a single website, single phone number, 1-800-1-RIDE?
I don't know that I would characterize
Okay.
it like that as much.
Okay.
And Councilmember Pico alluded to this, that it was a data sharing obstacle. From my observation, that was sort of the big holdup. They just didn't want to turn over their data. I kept hearing that was a corporate asset, and to turn that over to a public body where there's no guarantee of long-term contractual arrangements, that was a bridge too far for them, I think. Right? So this is different, where they're collaborating with one another to build this overall common database. And I don't know exactly how it's going to work yet. They're still in the development phases, where they're working with the software developer to be able to coordinate rides and the data that comes out of the ride matching. So it's a more of a virtual platform. But I'm hopeful that it's going to meet our needs as well from a financial management standpoint. So a lot of those details, I think, are still being worked out. But
Remember, the financial piece, I think, was a hard one, because some of these are reimbursed based on the type of ride, not the age category. We have veterans, we have disabled, we have a whole range of, and data is one issue, but now you can dip into my pocketbook, because you're allocating my rides I used to have to this other folks.
Right.
So people get a little possessive, right?
they do, yeah. But I'm hopeful. We've got a smart team working on it. And again, a lot of support from the service providers, from MMT, and from all the other entities that we need to work with. And if Dr. Cog can figure it out, we can certainly, I'm sure we can as well.
Amen.
Yes.
Does anyone from Mountain Metro or the other providers want to say anything before we move on? Craig? No, you don't? Okay. That's good. I'm appreciative of that. Anyone else? Jason? Good morning, Jason.
Put the glasses on first. This Jason DeBueno with Silver Key, and I also represent Envita, Fountain Valley, and community intersections in these conversations as providers. What this really is, it's not necessarily, as Andy was saying, a reboot of One Ride. What it's doing is two things. It's one, accomplishing to be able to have an algorithm really around specialty providers that deliver specialty care to a specific population. And what we did is we kind of tried to review what happened, what were some of the struggles. It was the data sharing piece for sure, but there was another piece that was really a challenge. The framework of what happens when you move into defined rides and defined pack doesn't necessarily work with specialty providers. As Yolanda was saying, there needs to be some nuance and some difference in the way we provide support to individuals with different needs. And so this is allowing for us to really tailor with what our core competencies are within those providers to be able to scale through, and through an algorithm, we will be able to identify which provider, based on their mission, based on their core competencies and their capacities, will be able to help support individuals to ride from A to Z, and we will be able to do this in a collaborative way through the braiding, actually, of the resources that we have available throughout the system. So we will be much more nimble with that, and what it'll translate to is more rides is what we're really working towards.
I appreciate you taking the time to share your expertise with us, Jason. Any other questions before we move on? Norm?
And real quickly, is it include anything up in Teller County with the senior coalition, or no?
Good question.
Well, yes. I mean, to the extent that we provide AAA service rides throughout the entire three-county region, yes, that needs to be part of the conversation. And I know Envita is looking at providing additional service up there as well. So, yes.
Potentially.
Yeah.
Okay, good question. Jody? Oh, I appreciate
Teller County Senior Coalition currently has their own 5310 funds, and I have spoken with Kathy, and so there would be discussions around what that might look like, whether she would have access to these funds or use other funds. So it's all part of the greater
Great.
conversation.
More communities working
Yes.
together.
Yes, ma'am.
Okay. We should try to say that 10 times during every meeting. Okay. Okay, moving on to our action items. The first item is the 2019 through 22 TIP amendment. Is that Catherine? Well, so usually we do the presentation, and then we'll have speakers and anybody providing public comment. Thank you.
Good morning, Catherine Wenger, Senior Transportation Planner, PPACG. So we recently received 4 requests to amend our TIP, or the Short Range Transportation Plan, or TIP Transportation Improvement Program. It has a few names. And we, throughout the year, we have occasional requests to amend this TIP just to update costs and or add or remove projects based on changing needs in the region. So the 4 requests include a total of all the projects you see listed in the table. The first one is related to the cost overrun funds that we had come back to the region, and then there are a few other ones that are being requested to be canceled, and those funds would be coming back to the region and then reallocated to that first one that you see. So based on that, in December, we held a call for projects announcing that those funds would become available to the region, and to see if any projects were having cost overruns and would like to receive those additional funds. We did receive 1 request from Colorado Springs for their 30th Street project, which additional stormwater issues or requirements proved that they needed some additional funds for this project. And so they requested the additional just under 1.9 or just under $2 million that would be coming back to go to their project. And so the first amendment request you see in the table is to add those funds to the 30th Street project if approved, and that would update their total cost of project to make that project mostly whole. CAC actually brought up there's a math discrepancy in the description that was provided. Colorado Springs has assured us that there is a small amount that is still kind of hanging out there that is needed, but they believe that they can make up for that in cost savings through various pieces when they actually get the full design done and then put it under construction. Or they would do a local overmatch. So if they need more funds, it would not come from this from PPACG pot. And then moving on to the other items of request, we have a cancel project request from Manitou Springs for Canyon Avenue Bridge, and that amount would come back to the regional pot and potentially be reallocated to 30th Street, and that's because they realized that they've already completed the work that needed to be done, and they didn't need those funds any longer. We have requests from MMT Colorado Springs for Route 9 to be canceled and return those funds to the pot based on that project being done with other funds as well, and so that project is complete. It just was done with other funding. We have 2 requests from Monument to cancel their projects for sidewalks on Beacon and Lincoln, and this is because changing priorities in Monument, they would like to focus their local match that they need on a different project, and so they would like to return these so that the funds don't lapse and that we can return them elsewhere. And then we also have a ad project for 2 battery electric buses from Colorado Springs MMT. This is an award that a grant award that they received from FTA, and it was a competitive grant, and so these just need to be added to our TIP so that they can spend those federal funds. There's also a request to adjust the scope of the Creek Rock Trail Phases 3 and 4 from Manitou Springs. This would not change the funding at all. This would just change that originally they had requested funding to design Phases 3 and 4, and instead they would like to move the design piece, our funding, from Phase 4 and actually construct Phase 3. And so this would ensure that they can actually get a piece constructed, and they've come back and for other grants to request continuing those phases elsewhere. And then finally, we have an add funds request from Copper Ridge. This is a private developer, but they are building I-25 and State Highway 21 or Powers interchange with their private funds. But since it is a regionally significant project, it has to be included in our TIP. And since it is already in the TIP, but the price has increased, and so we are requesting just to add those funds. And those are all private funds. They're not funds that come from our regional pot of federal money at all, or state money.
So just to be clear, those aren't private funds, really. They're still public dollars. They're just not coming from the normal TIP source.
Correct, yes.
Okay.
That is the caveat. For us, it's considered private as far as the TIP goes,
Okay.
but it is...
It's Colorado Springs Urban Renewal Project.
Yes, thank you.
Okay. Just to make sure.
So both TAC and CAC recommend approval of this TIP amendment.
Are there questions from the board? The developer is here for the Copper Ridge project because that's, of course, the biggest item on the list. So I just let you know that if you want to have them come forward before you ask questions or ask them questions now.
I don't have a question.
Okay.
Move approval.
Oh, okay. Second? Okay, Yolanda, second. Now we'll have some discussion. So I know Mr. Erickson is here. Oh, he was here. Tim, did you want to speak? Okay. Okay, I take back what I said. The developer is not here anymore. But if you have questions about that project, they have representatives here. Otherwise, we have a motion and a second. Anything else, Catherine?
And say if they have more questions, they can reach out to me and I can
Okay.
get it for them.
Norman?
Yeah, thank you, Jill. The question several years ago when the Copper Ridge project came up was whether or not the project will be built to CDOT federal highway standards. The money was far under allocated. We didn't think it would be done within the requirements of federal highway standards. And I'm curious whether the additional funds now will provide the adequate funding to meet federal highway standards.
Good question.
Maybe that's a question for CDOT.
Yes.
Ms. Rowe.
So what specifically for the I-25 and Powers interchange?
Right.
Yeah, they work with us because they're doing it under kind of an access permit or, so we say, yeah, you have to meet our maintenance standards. We will maintain it when they're done, at least everything within our right-of-way. And so we've been working with them on what that looks like. But they have their own construction oversight. We just verify that all the testing meets that requirements, and we work with FHWA because it is interstate. Then it meets all their requirements, so.
Okay.
That's-
So this meets your engineer standards, the project as designed will meet standards?
Yes.
Okay.
Yeah, it meets all of our standards. It doesn't have any federal funding in it, so it doesn't have like Davis-Bacon wages or the testing. But a lot of the testing requirements still need to meet CDOT standards in order because we maintain it. We have one person who oversees the project part-time because they have their own construction oversight group, but our group kind of is a quality assurance, making sure that everything's done as it should be.
I'd love to see a project like this. I mean, I'm just glad we can.
Creative.
It's pretty common around the state,
But
so,
that's great news.
yeah.
Okay. Thank you, Norman. Any other questions? Okay, well, I have a motion and a second on this item. All those in favor, please say aye. Aye. Any nays? Okay, motion passes. Thank you, Catherine. The next item for action is the annual safety target setting. Is that also Catherine?
Good morning again. Catherine Wenger, Senior Transportation Planner in PPACG. So as the designated NPO for our region, PPACG is responsible for ensuring we complete federal requirements related to performance measures. This performance measures are used to track and monitor and maximize the benefit of the transportation dollars, so the federal dollars that we receive for our region. And they do that by linking the infrastructure investments in our long-range plan and the TIP. And so there are a total of 20 performance measures, but right now we're just talking about the safety measures that are required and we're required to set targets each year based on updated data. And so the safety targets that we're required to set for our region, or we support the state targets, which I'll get to in a second, are number of fatalities, the fatality rate, the number of serious injuries, serious injury rate, and number of non-motorized fatalities and serious injuries. These are calculated using a 5-year rolling average from the previous years And the data that we get and you see here are the statewide targets, and we get that data from CDOT. And so in your packet, there's a presentation or slides that show more detail on where this data came from and the trends that CDOT has and where they got these numbers, where they set their targets. So as an MPO, we have two options. We can either set our own targets for the region, or we can support the state targets through our project selection criteria and the processes that we use for our long-range plan and our TIP. So as Jason mentioned before, our project selection criteria does include safety measures to ensure that the projects that we're selecting includes an aspect of safety. And so that is already incorporated, and that would be how we support the state targets in our region for those. Over the last 2 years, PPACG has chosen to support the state targets, and that is what TAC and CAC recommend again this year, and we would do so by that same processes, but also still doing the other aspects of safety campaigns and things that Jason mentioned prior. And so that's all.
Okay. Questions for Catherine? Norman?
So Catherine, tell me how the statewide targets are allocated to the regions, to the MPOs or to the TPRs?
The targets?
The targets. How are they allocated statewide?
They use the data from the entire state, so they don't separate them out by region. It's a statewide target completely, and each MPO can set their own, like Dr. Krog does set their own, or we can just choose to support the entire statewide target. So it doesn't separate it by region.
Okay, so how does the state reach a target if not through the cooperation of the TPRs and MPOs? But by setting suppose we set our target as, so our target is all of the entire state, and hopefully not, hopefully not. But obviously that would completely undermine the state target if our target weren't aligned somehow.
They do it through their STAC and statewide MPO process, our committee processes, but they also, through recommendations, through that way. But they do the data analysis statewide and then provide what their suggested targets are. So they do that through their committee approvals, is my understanding.
Through the MPO project, or through the MPO work group, or through, because it's not discussed at STAC, I can tell you that.
I believe it was discussed at STAC.
Well, the statewide targets were, but there was no discussion of below statewide.
Yeah. And it's not my understanding that they go to each of us individually or, as an organization and say, what is your target? They bring that the way at their committees as a statewide thing. So they don't come to us that way and ask us what our targets are.
Okay. Other questions? No.
It's not sub-allocated
Right.
below the level of the state is the challenge, and so we all kind of sink or swim together, I guess, as a statewide goal, sort of.
Yeah, and kind of mentions in the presentation that CDOT, if they don't meet those targets, the federal highway could restrict their flexibility in their state highway funding, and so in order to meet those targets, they set their statewide and what they can help meet those goals, whereas MPOs, we don't have that issue where they will restrict our funding. And so their view is it's statewide, and
Yeah. We share your concerns. Exactly. Okay, if there are no other questions or comments, I would appreciate a motion to approve CDOT's calendar year 2020 safety targets.
Move approval.
Second.
Thank you, Andy. Thank you, Norman. All those in favor, please say aye. Aye. Any nays? Motion passes. Our last last item is the legislative session update, and that is Jessica. Good morning, Jessica.
Good morning, everyone. You've got Jessica McMullen, your Policy and Communication Manager here with PPACG, and I've also got our lobbyist, Lauren Furman, on the line in case people have questions about specific bills.
Welcome, Lauren.
So.
And Dick's here, too, as our...
Yes, and Dick is our co-chair on these items. I'll give a quick summary. You should all have been getting an email from me after the legislative committees that week saying, do you have any objections to the positions posed by the board, by the committee? If we hear any objections, that is not the position of PPACG. If we hear no objections, we give Lauren the go-ahead to begin acting on the positions of the legislative committee. Do you want to go over all the bills or bring up some highlights, or what would you like to do? Sure.
I think it might be good. Seems to it's been a whole month, and we've got 21 bills that we briefly at least go through all of the bills. I will make note, I checked this morning, there are 478 bills listed, and we only have 21 that I think we're concerned about. So we're saving you a lot of time and effort and pain.
Still with 21, let's keep it brief.
I will be speedy quick.
Okay.
So the bills that we have looked at, House Bill 1042 is a cleanup bill of an error in the initial bill last year that said it had to go into effect by August 2019, which wasn't possible, and modifies it to go into effect August 2020. On its most recent action, it went through the House, and on the 6th was introduced in the Senate and assigned to local government. The next bill that we looked at was House Bill 20-1073. This was a County Commissioner District Gerrymandering was the name of it. It required independent county commissioner redistricting commissions to divide counties that have county commissioners not elected by the voters of the whole district into county commissioner districts. This bill is one that we had initially suggested a position of oppose. We did hear an objection from the board at large, and that position was moved to monitor, unless something is changed on that. This bill has, of the 5th, went over to the House second reading and has been laid over daily with no amendments. The next bill on our list is 1119, a state government regulation of PFOS/PFOA. Some of the sponsors on it are our local legislators, Tony Exum, Lois Landgraf, Dennis Heisey, and Pete Lee. The bill addresses the authority of the state government to regulate. It has a lot of complicated aspects which are still being developed, and we're still determining those impacts. This is a bill that we are monitoring with the potential to amend based on how it comes out. We are continuing to monitor closely on this bill. It has not gone anywhere. It was introduced in the House on the 15th. Sorry. The next bill that we looked at and took a position on was 1137, broadband grant certification of unserved areas. We're supporting but not engaging this bill. It just asks the Broadband Deployment Board to give a little more weight to when local municipalities tell the state board that this is an unserved area. So we're just asking them to give a little more weight. That is a bill, again, we are supporting. As of the 16th of January, it was introduced in the House and assigned to Business Affairs and Labor. 1139 is a peer support professionals behavioral health. It creates a tax credit to support eligible individuals going into mental health professions. This one will have a pretty good-sized impact on rural mental health care providers, something that we all know is very important. It's one that we are supporting and monitoring for additional impact. That additional information that we're really looking at is the fiscal note. House Bill 1151 expands the authority for regional transportation improvements. This is one we are monitoring. It's regarding MPOs becoming transportation authorities. It was introduced in the House on the 17th and assigned to Transportation, Local Government, and Appropriations. House Bill 1220, Veterans Community Living Center Services Assessment. Again, this has some local legislators on it, Mark Snyder, Terry Carver, and Pete Lee. This is one that we are supporting and are willing to offer help, if needed, to our legislators. This is a needs assessment that is required in the pursuit of a VA home in El Paso County. So this bill on the 30th was introduced in the House and assigned to State Veterans and Military Affairs. 1233 is basic life functions in public spaces. This is one that we are suggesting we oppose, but do not engage unless necessary. It prohibits governments from restricting homeless activities unless that government can offer adequate shelter and services, and from acting against people living in legally parked cars. On the 31st of January, it was introduced in the House and assigned to Transportation and Local Government. Again, I'm going fast, so grab my attention if you've got questions. Senate Bill 2022 increases medical providers for senior citizens. This is one we are supporting, again, monitoring for the fiscal impact. It modifies the Colorado Health Care Service Corps program to expand the availability of geriatric care providers in shortage areas in the state. Really big rural impact. This one was, as of January 30th, was in the Senate Committee on Health and Human Services and referred unamended to appropriations. Senate Bill 33, and I'm not keeping up necessarily on the screen, I'm sorry. Okay, sorry. So Senate Bill 33 allows Medicaid buy-in program after age 65. We're monitoring this bill. It allows adults with disabilities who are currently working and buying into Medicaid to continue doing so after turning 65 instead of being forced into just Medicare, which won't cover some of their needs. As of the January 8th, it was introduced in the Senate and assigned to Health and Human Services. 2044 is a sales and use tax revenue for transportation. We did support this. It did have local legislators, Paul Lundeen and Terry Carver, and it died. Senate Bill 49 is the senior property tax exemption, medical necessity. Again, this had some local legislators on it, Bob Gardner and Terry Carver. This is one we supported, and this one also died. Sorry. As of January 29th, the Senate Committee on State Affairs and Military Affairs postponed indefinitely. Senate Bill, it died. Senate Bill 65, limit mobile electronic devices while driving. This is one we are supporting but not engaging on. It limits the use of cell phones and tablets to only through hands-free accessories while driving. This bill had actually already been in place for minors, and it establishes fines. This is one we're unsure if it'll be a primary charge or secondary charge, and as you heard from the safety presentation, that can lay an impact on how effective it is. On the 8th of January, it was introduced in the Senate and assigned to Transportation and Energy. Senate Bill 69, Disabled Veterans Free State Park Access. Again, we have some local sponsors. They are not the prime sponsors, but Senator Gardner, Gardner, Heisey, and Lundeen. I'm mixing up the senators. We are supporting this. It allows veterans to get a state parks pass, even if they don't use the disabled veteran license plate, for the quick summary. It was introduced on January 28th, introduced in the House, so it has been moving promptly through the Senate. It's already in the House, and assigned to Rural Affairs and Agriculture. Senate Bill 2091 is a minimum pay for state military forces. Again, it's got a local sponsor prime, Tony Exum, and some not primes, Gardner, Heisey, and Lundeen. This is one we are supporting but not engaging on. The current minimum pay for a member of the state military force called to service by the governor is $20 a day, which comes up to $1 and some change. This bill will increase that to $88.80. It has already gone through the Senate, and as of February 4th, was introduced in the House and assigned to State Veterans and Military Affairs. Senate Bill 94, plug-in electric motor vehicle registration fees. We are supporting this with an amendment moving the funding from HPTE to HUTF. The goal of this bill is to create equality in road funding between electric and gas vehicles, and it increases the registration fees on plug-in electric vehicles. It was introduced in the Senate January 13th and assigned to Transportation and Energy. Senate Bill 122, Mobile Veterans Support Unit Grant Program. This is another one we're supporting but not engaging on. This provides one-time grants to nonprofit organizations to establish mobile veterans support units. The Veterans Community Center Board, statewide commission, was brought this bill to look at by Pete Lee. As of February 5th, it's at the Senate Committee on State Veterans and Military Affairs and was referred unamended to appropriations. Senate Bill 128 is the generation and transmission of cooperative easement broadband. This is a position where we're monitoring it to let individual members review and see if they have any insight from their governments. This adds electric generation and transmission cooperative associations to the current cooperative electric associations authorization to install or allow broadband install themselves or allow commercial installation of broadband on real property. It also authorizes the installation of new underground broadband facilities within that easement. As of January 27th, it was introduced in the Senate and assigned to local government. three more. Senate Bill 2148, property tax exemption value adjustments. We have several local sponsors, none of whom are prime: Gardner, Heisey, Lundin, Carver, Geithner, Landgraf, Liston, Sandridge, and Williams. This is one we are supporting but not engaging on. Currently, the first 50% of the first $200,000 of actual value on a property of someone with senior property tax exemption or the disabled veteran exemption is exempt from property tax. This bill just increases that from the $200,000 to $435,000. It exempts new construction, and it's designed to address issues as seniors and veterans' houses that they have been in for a long time increase in value, to continue to balance that out. This was introduced in the Senate on January 27th and assigned to Finance. The Senate Bill 157 is the vacation of roadways by municipalities or county. This is another one we're monitoring to allow members the chance to review. The bill authorizes, and part of why we're reviewing it is we don't know if that means allow or requires a government to charge fair market value to land being vacated. The charge would be to the person who will own the property once the government gives it up. As of February 4th, that was introduced in the Senate and assigned to local government. So those are the bills on which we have taken a position. We did bring up at our last meeting, and the committee will be reviewing at the next, House Bill 1095, which is a local government water elements and master plans. We're waiting for Lauren to give us information because we don't have it. And it authorized local government master plan to include goals specified in the state water plan. So there is the, I talk way fast, review of the bills.
You did a great job. I appreciate that. That was a lot of information. Dick, do you have anything else you'd like to add?
No, we've had
Okay.
a lot of good discussions.
Make sure you're on.
Ta-da. No, we've had a lot of good discussions in the committee going through them. There've been a lot of bills that have been brought up as maybe we might want to take a look at them, and we've eliminated them because we kind of used what our guiding principles are on, does it affect PPACG? Is it
Right.
something that we should follow? So other than that, I would make a motion that we approve the actions that the committee has already taken.
I very much appreciate that motion.
Hi, Lauren, I've got you on the line, but I'm letting Dick talk, so.
Does Lauren have something to add? Updates? Bills killed?
I can hear you. I'm
Okay.
shaking my head as.
Okay. Any other comments? I need a second to that
Second.
motion. Okay, Andy, Norm, did you want to say something?
I'll just say this is, so I testified on one of these bills, I'm testifying on another one this afternoon. This 1173, which is the 811 locate bill.
Oh, great.
It's a CCI bill. I'll testify in support this afternoon.
Okay.
It is important to local legislators. They really, really appreciate it when people on this table show up.
Good point. Very important.
So if you can free up time when they call you, be there.
Yeah. Yeah, thank you, Norm. I can't stress that enough. Anything else, Jessica?
That is it.
Okay, then I have a motion and a second to approve the recommendations of the Legislative Committee. All those in favor, please say aye. Aye. Any nays? Okay, motion passes. That concludes our action items.
Could I ask Jessica to talk about our breakfast coming up?
Oh, that's a great idea. Thank you, Norm. Jessica, please
So-
update us.
February 21st at 7:30 in the morning. You are all, and your other fellow members of your local governments, invited to join PPACG for breakfast with our legislators up in Denver. It is across the street from the Capitol. You have all gotten an email from me with its location, a reminder of the time, and just a little tag that if you'd like to carpool, we know several other people who would like to not drive up individually. So if you reach out to me, I will share all of the carpool people's information in an email. The final date to register to let me know you're going to be there is Monday the 19th. Okay, maybe that's Wednesday.
Do you mean Monday?
I mean Monday.
Whatever Monday is.
Yeah, Monday, the whatever
Okay.
it is, so that we have time to order breakfast for the correct number of people.
Perfect.
We do have almost all of our delegation has now responded that they will be in attendance.
Oh, wow, that's huge.
So it's very, very important that we have a good showing as well. So if you can make it, please do.
Great, thank you. I encourage everybody to attend. Thank you again, Norm, for, yes, Cammie?
I just have a quick question. Did you officially need this board as a whole to vote on your recommendation request to move House Bill 201042 from monitor to support, or was that included in
The overarching
what the
recommendation.
legislative committee
Yeah.
said? Okay.
Thank you for that clarification. Anything else?
Actually, my dispatcher.
I hear you, Turner. Okay, on to our reports, unless there's something else I'm forgetting. Military installations, TJ, is that what okay. Good morning, welcome.
Good morning, thank you.
Peterson.
Yes, ma'am. Representing Peterson, Colonel Falzerano. Thanks for the opportunity. A few big items here. We just finished construction of a helipad on Cheyenne Mountain Air Force Station.
Nice.
We'll be testing and doing a day test and a night test hopefully this month. That is not going to be operational 24/7. It's on a requested. You have to request use basis. Not like it's going to be used like an airport. We just completed construction of Cheyenne Mountain Road. We just did reconstruction and repair there for the whole road. I wanted to thank the team, the relationship we have with Colorado Springs with the Mark Shuffle Road and our East Gate. We put in, the city put in lights funded by the city, and now we're working on putting in warning flashers to help with the accidents there, and
Nice.
Really appreciate all that support with that and the Safe Our Community. We also finished a North Gate that's coming out of our North Gate going on to Peterson. A traffic study for our North Gate, future North Gate. This will be finalized hopefully this spring, the study on a COA that we can proceed for funding with, and it goes right in tune with all your city planners on helping traffic congestion coming off Peterson Avenue and Highway 24. So again, great relationship and really appreciate all the support. Everybody should know we got $54 million approved in the NDAA for the Stock North headquarters building, so we look forward to giving you guys all the updates in the future on that. And another big news I don't think was covered yet was the Secretary of the Air Force approved the basing decision for the 721st Operations Group at Peterson Air Force Base. I think the big impact to us would be the 467 total authorizations is an increase of 174 from where we are present. That happened again January 15th.
Wow, it's a great update. Thank you.
Yes, ma'am.
We have a council member who'd like to add something.
Just a question of clarification. On the helipad up at Cheyenne Mountain, where, is that at the old location or is it a new one?
It's new. Brand new FAA certified helipad.
And is it, well, I'll ask you offline. Okay.
Yeah,
I'm just curious where it is, because we used to have one up there back when I was up there, so I'm just curious where it is and what's different.
I would say right after the entry control point, further up the mountain on your right side. It was, I think, probably the largest switchback turn when you're going up to the mountain. It'll be on your right.
Okay. Well,
So-
that is a completely new one then.
Yes, sir. It is.
Okay, thanks.
Okay, thank you. Melissa?
Yes, hi, Melissa Porter from the Air Force Academy. Really only have one major thing to brief, the NHL hockey game this Saturday.
That's huge.
It's huge. The stadium holds 43,500 seats, so NHL is expecting a sellout crowd, which means we expect some congestion near our gates. I'd recommend if you're not coming to the game and you don't have to be near the academy between the hours of 4 and 6, then avoid the area if you can. And again, at the conclusion of the game, probably around 9 o'clock for about 2 hours.
Right.
Specifically, I-25 is coming from Denver and then departing that way after. On a much smaller scale, the Falcons will be playing against Colorado College on the same rink in Falcon Stadium on Monday at 5 o'clock. Tickets are available for that game. They're $25, and you can go to aftickets.com to purchase those.
Okay.
And that's all I have, unless there are any questions.
It truly is exciting what these games are bringing to our region, so really thank you to the Air Force Academy. And I just try to imagine if there was a hotel right there, all those folks could just stay in the hotel. There wouldn't have to be any driving.
Imagine that.
Sorry. I couldn't help it. Okay. Ron?
Madam Chair, board members, thank you. Ron Jeffrey from Shreveport Air Force Base. Concerning the stand-up of U.S. Space Force, just rest assured that work continues. Representatives from the 50th Space Wing are participating in a number of working groups that are defining the organizational structure for the command, which right now is at the wing and level and below. No firm decisions yet, but we continue to work that. So, but in the meantime, rest assured that operations continue at Schriever Air Force Base, that our space operators are there making sure our satellites are operating. In fact, if you use GPS in the recent past, that's one of the systems that we make sure is on orbit and operating optimally. So again, we're there doing the work in spite of all the changes that may be coming up in terms of organization.
Right.
The mission remains the same. We continue to execute that. Along the lines of communities working together, astronaut Colonel Nick Hague came out to Schriever Air Force Base, did a presentation for both the folks who were on the installation there at Schriever Air Force Base, but we also invited some students from Ellicott to come over and hear his stories about his experience on the International Space Station. And I think it was a well-attended event, and we certainly enjoyed that. For upcoming events, on the 13th of March, we're going to have our Team Schriever Annual Awards Ceremony at the Antlers Hotel. Looking forward to recognizing our top performers and the great work that they're doing for us. And then the final thing I'll mention is next week, next Wednesday, Schriever Air Force Base will be hosting the Military Affairs Council's Area Chiefs of Staff meeting at Schriever Air Force Base, an opportunity for folks to make that trek out there. It's only probably about 10 miles, but still, to make the trek out there, to find out what's going on at Schriever, and then share the other things that are happening within each of their organizations. Unless there's any questions, that's the update that I have from Schriever Air Force Base.
What was the date of that event out at Schriever?
It's the 19th of February.
Okay.
Right, and it'll start at 11:30. Mm-hmm.
Okay.
And you can, anybody who's interested can contact our folks in public affairs to make sure that we get you on the access list.
Thank you. Great update.
You're welcome. Thank you.
I think that completes our military reports. If I'm not mistaken, we will move on to the Transportation Advisory Committee. Brandy Williams, good morning.
Good morning. Brandy Williams, Chair of the Transportation Advisory Committee. We met January 16th and also approved the same things that thankfully you all approved, one slightly different. So
Thankfully.
The TIP Amendment number 12 for fiscal year 2019 to 2022, and then we also approved a schedule update for multimodal options funding to just push it out a little bit to get jurisdictions more time to submit those applications.
Great. Okay.
Any questions?
Questions? Okay, thank you, Brandy.
Thank you.
Appreciate you being here. The Community Advisory Committee, Tim O'Donnell, good morning.
Tim O'Donnell, Chair for the CAC, for the PPACG. I did not physically attend the last meeting, but Aubrey gave me some updates of what happened, so everything I'm saying won't hold up in a court of law hearsay. But we did have 3 new members for Rama, League of Women Voters, Juliet termed off, and El Paso County. We did go through the TIP amendment, and as Catherine pointed out, we found the math error. But we were assured that the money would all be there to complete the project, which I'm assuming means that we also will not see them coming back for more money later on. There was some confusion around the legislation for electric vehicle registration as to whether that was going to be re-registered or just new registrations or what was going on there. And I think we'll get that clarification next meeting to specifically know exactly what was going on there.
It's a good question.
That's basically it.
Okay, questions from the board? Thank you, Tim. I appreciate you being here. The Mobility Coordinating Committee. Jolene, good morning.
Jolene Hausman, new chair of the Mobility Coordinating Committee.
Congratulations.
Thank you. So the major change that happened at our meeting on January 28th was I'm now chair, Dick with Community Intersections is vice chair, and Miley with Drive Smart is second vice chair. We did have an update on the transit mobility guide that we'll be redoing those, and they should become available early summertime once we hammer out all the details of the specialized transit plan for our community. Special Kids, Special Families did a presentation on all of their services and their immense of growth that they're having in our community. And then the most special part of the meeting was our driver recognition. Every single agency recognized their driver of the year at the event, and some of the drivers spoke, and you could just hear how much their jobs mean to them on a daily basis. And without them, none of our agencies could do what we do. And I would just like to note one of our Fountain Valley drivers, who was our driver of the year, actually made a systematic change with Memorial Hospital this year. They used to only allow us to drop off at one entry point, which is actually an ADA violation because they have 4 ADA accessible doorways. And so they actually changed their policy system-wide that now all specialized transit and paratransit providers in the region can drop off at all 4 locations, and gave it to all their staff. And so now all of our senior and disabled populations can go to the door that they want to go to.
That's great. Thank you, Jolene. Okay, Regional Advisory Committee. Good morning. Dixie.
Thank you. Hi, I'm Dixie Wodell, and last month was my first meeting as the new chair of the Regional Advisory Council, and we had only 2 action items. Basically, we approved the TRS fund carryover funds, and you heard all about that from Jody already. And we are also in the process of fulfilling all of our membership vacancies that came about by term limitations at the end of the year. So the only one that we're really kind of working on right now is Eastern El Paso County, and hopefully we'll get those people in soon because we want to represent that area, even though it's mostly rural. We did talk about census count and making sure that all of our seniors, we want to support that, even though it's not something that we financially support directly, but we want to make sure our seniors are counted because, as we all know, everybody counts when it comes to funding. So we want to make sure that that's done. We do have on our calendar of events coming up February 27th at our Regional Advisory Council meeting. At 10 o'clock, we will have a short meeting, and after that is the provider fair. And so it's a good time for any of you who want to come. We invite you. All of our providers will be there, and they will have an area where they can answer questions and talk to you about what they do and what they provide for our areas, our Tri-County areas. So if there are any questions, I just thank you all for your support.
Thank you so much, Dixie. Are there any questions? Okay. On to our CDOT monthly update. Karen. Good morning.
Good morning. I don't have anything big to update. We have projects under advertisement now, and some projects finishing up in the area, US 24 West, and some projects that'll be starting out east. So I just didn't know if anyone had any questions for me.
I have a question. So I see those shrouded lights coming as I'm entering the freeway now. So when do you think those will be up and running?
That's the rate metering. It'll be a little while. We need to connect to our fiber network, and we're having issues with that connection. So the hardware is in place, but there's some underground and background stuff that needs to happen before they start again. I'll find out and see if I can send it out. My guess is April or May, possibly as late as June. We debated on whether to put those up or not. So I know they're up and people are wondering when they're going to go,
Right,
but
right.
at least we have them in place for when they're ready to start. But there will be a pretty big outreach when we start to utilize them. But again, they're pretty similar to Denver with a little bit more advanced technology to have them sync together. Okay. To help monitor traffic coming onto the interstate.
Okay, yeah, I appreciate knowing there's going to be some education. Glenn?
I have a question for Karen.
The face.
I have a question for Karen. As a resident of Palmer Lake, can we please get an update on the gap? The accidents, the numerous accidents over the last few weeks with snow, the road closures, all the detours into Palmer Lake coming in through Larkspur. On the weekends, no one can get out, and people are really, really starting to get frustrated. Those high berms on the side of the gap, it's really becoming especially problematic on the weekends and on early mornings. People from Palmer Lake are having to leave to hit Denver at 5, 6 a.m., just not knowing what's going to happen on the gap. And we get asked every day just for a gap update.
Are you on the text chain?
No.
Okay. I'll make sure that everyone here, and I'll see if I can find out and give it to you before you leave today. But there's
Okay.
a text number you can text, and it'll alert you to things. And then there's an email, weekly email that goes out, email blast that tells you what's going on all the time. That's in Region 1. It can have also someone come down. I know they're looking at possibly reducing speed limits, from the 65 now, but there's not a lot more update I can give other than to provide you the information updates that come out through the project.
Okay.
But it's going to be pretty painful until it's done is my...
It's really painful
Painful.
right now.
Thus, we carpool next Friday.
I know we put in a temporary signal on 83 to help with that, so with that alternative traffic, but otherwise, I don't know what else to do to help besides the communications and
So with the bridge
get
coming down
construction.
now over Larkspur, and with the bridge coming down, what's happening to us now is people are getting off the freeway in Larkspur, taking the 9-mile roundabout into Palmer Lake, and what's happening is it's backing up Highway 105 so bad, and people can't get on or off at County Line, that if there's an accident, which is weekly, several times a week through the gap, people can't get out of the neighborhoods in Palmer Lake because 105 is a parking lot.
Well, let me get your contact information. I can put you in touch with the project team.
Okay,
Because,
thank you.
yeah, I'm just not involved in the project, so I don't have very much details on the information, but I can get your information and relay it up to the project team.
Thank you.
Thank you, Karen.
Most of the projects in Denver's region, not ours.
Okay, any other questions? Sharon?
I would just like to thank you guys for the improvements you've done on the freeway entrances, the signage, the stuff on the ground. It's been probably 3 months since I have seen somebody trying to go southbound on the northbound exit. So it really is paying off. Instead of turning left onto the off-ramp, people are actually coming across the freeway. So thank you so much for that.
Oh, you're welcome. I'm happy to hear that. I know driving home, I used to see people try to get on the interstate, and I had them increase the signs. But, yeah, that was an effort along I-25 from state line to mile marker 161. It was about $2.8 million to improve the pavement markings and the signings all the way up and down. And so we now have signs that also show this is an on-ramp, right, that we didn't used to have before, much closer to the on-ramp. And then the pavement markings, I've gotten a lot of compliments. And so we're hoping for less wrong-way accidents and then better customer service, right? It helps people feel more comfortable as to where they're going. So I'll pass that on.
Great. Thank you, Sharon, for good news. Turner?
Thank you, Madam Chairman. My son lives in Colorado Springs and works in Denver right now. He will probably, within the next 2 to 3 months, get transferred to Colorado Springs. In the meantime, it's been a combination of leaving early and staying overnight in Denver. And probably this winter, he's stayed in a hotel probably 10 times already. His employer is not somebody that's going to allow him to come into late work or come into work late. They will write him up. They will fire him. So being late's not acceptable. So that's why he, shells out the money he does for hotels. So, it's a tough project, and everybody knew it would be, and it's it's not whether you got a four-wheel drive or anything else. It's just it's a tough commute, and it doesn't matter so much whether you leave early or not, because if there's an accident, it's gonna plug up, and it is what it is, and I think you just have to come to terms with that. Thank you.
Thank you, Turner. Okay, on to STAC. Norm?
Let John
John?
Lasalas open this.
Well, do you actually want to do the January meeting?
Why don't you go ahead?
Oh, okay.
And we also should note, I know that Dick Elsner and Turner also attend that meeting, and so we'll cover from the PPACG angle. And Dick, if you have some comments from Central Front Range, let's jump in.
Great, thank you.
Thank you, Madam Chair, members of the committee. We're going to try something a little different. Not only will we cover what happened at the last month meeting, but because the meetings have been moved, we do actually have the agenda for the meeting that's in 2 days. So we'll try to take a little less time of what's happened and put that time towards what's going to happen, so you actually can get sort of a heads up and decide if that's something you need to reach out to Norm about beforehand, or make the trip up, or not make the trip up if the agenda is such that you don't want to. At the January 10th meeting, I think other than the sort of standing agenda items, the item that took the most amount of time was a discussion on statewide CMAQ funding. With PPACG and others around the state coming into attainment, there are CMAQ funds that can get reapportioned, and CDOT has made the recommendation that those funds should go to a statewide program to do electrical vehicle charging stations. That would still impact the PPACG region, allowing electric vehicles to be charged within our region. Otherwise, the use of those CMAQ funds are very limited. So there was an extensive discussion as to electric vehicles themselves, but regardless of where you stand on electric vehicles themselves, the nexus of this conversation, of course, was what to do with those additional federal dollars, because they are coming in, and this would be a mechanism by which the folks in the Pikes Peak region would still be able to utilize some of those dollars. So I think the discussion after, again, was pretty lengthy, was put on hold, and is going to be actually, spoiler alert, on the agenda for this month as well to continue the conversation. There was also a discussion on, well, actually, that ate most of the time up. So there was also an additional update on the Central 70 project update. And I think they did postpone the Express Master Plan. The HPT, yeah.
That one, so yeah, it's not been included yet.
So that's an update on the January. Does anyone want to chat about that one? And then I'll go into February.
I'll just mention that, well, go ahead, I'll wrap up.
And then February, again, this is the meeting that's here in 2 days, and several of us will make the trek up to Denver for it. There is the standing, regular standing items of the state and federal legislative report, but there will be a discussion of the Performance Directive 14, the asset management measures. There will be the continuation of the CMAQ program discussion. There will be a update on the statewide plan update, and included in that will be the 10-year strategic pipeline of projects. That strategic pipeline of projects are, again, those projects that have already gone through the TAC. You guys, I believe, saw, Catherine's not here to help, but I think you guys saw them back in December, if I remember correctly. So they are the projects you've seen, and they've now been rolled into the CDOT process. And then there will also be a discussion on the Strategic Safety and Urban Arterial Initiative update from Rebecca White. So again, talking about how the CDOT and the statewide safety initiative is moving forward. So those are the items that we're going to address in the coming days.
Just a couple things. You may know that, as you recall, Rocky Scott, our former Transportation Commissioner, was replaced by Mr. Irv Halter, a former director of DOLA. Irv attended his first meeting with Transportation Commission, and I introduced him as incoming Transportation Commissioner. Everybody was kind of looking forward to meeting him. I've spent a little time with him since then, and he is learning. The old, drinking from a fire hose is probably an understatement. Also, I just want to cover briefly, there's been a discussion statewide on transportation funding generally. The other day, John and I attended that discussion, and he's attended some in the past, about how do we proceed, because the public vote on 3 different issues now, 109, 110, and most recently CC, have all been turned down by voters for how are we going to pay for roads. The discussion has moved now to what are the solutions can we do in-house within the legislature in cooperation with the governor's office. A couple pretty practical things have come up, and they've not gone to stack yet, but I think I'm not sure why I'm a part of this discussion other than perhaps I'm on stack, but it is still contentious, but I think that we should expect to see something in this legislature. I really do. One of the things we didn't talk about in Jessica's legislative update was House Bill 1151, which is the bill that would allow local RTAs to become taxing districts. The MPO could become a taxing district by law. That one's not going to fare well. It's kind of the nuclear option that would carve up every man for himself. It would be no longer a statewide solution. It would be you guys figure it out, you local folks figure it out, and nobody really wants that solution. So there's still some good effort at the statewide, and every stack meeting there is a legislative update, and here's the nexus, is that I'd like to be able to carry that opinions and attitudes from this board. If you have attitudes of how you'd like transportation funding to proceed, I'd like to help carry that to a stack discussion, because it really relates directly to how we're going to do roads in the future. So kind of offer Dick or Turner, any comments from your side? You also attend those stack meetings on Central Front Range.
Yeah. I really don't have any comments, but the conversation on the charging stations was long. From a Central Front Range standpoint, I kind of support the idea of putting them in, mostly because we have people from Denver who want to go to the mountains and get there and discover they can't charge their car, and then they end up abandoned along the side of the road or camping out. Anyway, so...
really long extension cord.
Really long extension cord.
Funny. Good one. Okay.
You can't carry a gas can full of juice.
Do you want to add something, Turner? Oh, okay.
Back to you.
Okay.
Thanks, John.
Our last report is our Executive Director's report.
Thank you, Madam Chair. Just real briefly, I've got 3 items. I've mentioned before we have a partnership with Sunshine Home Shares. It's the group that is looking at helping seniors age in place by teaming up with non-seniors, doing a proactive kind of a roommate matching service. And Sunshine has hired their employee that's going to run the program down here. It's Teresa Ornelius, and she's working out of our space upstairs. We're kind of providing incubator space to stand them up and get them moving. So we're really super excited about that. There's a workshop coming up next Wednesday, the 19th, 12:30 to 2 in this room. Really, it's a focus group discussion around how to help the new affordable housing and aging in place solution become reality. So we're pretty excited about that. What I'd like to do is schedule a presentation around the program in the next month or so with the board, so you can hear more about it. We're getting interest already. I think her name and contact info is getting out there pretty quickly, and there's a lot of interest already from our senior community and non-seniors. So we'll talk more about this in the coming months.
Andy?
That's great.
Yes.
I have a senior in Fountain that's called that number 3 times and left messages, and no one has called him back.
Okay. I will make sure that connection's being made. Yeah, the former person that's been listed on the brochure, I think, is the person out of Denver, but now that we have a local contact, there's going to be more responsiveness, I would think. So let's talk afterwards. Okay. Thank you.
Okay.
Okay, second thing real quick, also happening on the 19th, next Wednesday, is our Air Quality Technical Committee is going to meet, and Samantha Bailey's lined up a really interesting presentation. Some of our counterparts from the Central Texas Council of Governments will make a presentation about a study they did a couple of years ago around the economic impact of going into non-attainment for ozone. They estimated in their region, and I think it's a smaller region compared with ours population-wise, covers the Kylene and Temple communities and a bunch of counties around there. But what they found is that if they went into non-attainment for ozone, it would cost their region $25 to $40 billion would be the impact of their economy on transportation, on business and manufacturing requirements, transportation project delays, potential loss of federal funding. So they're going to make a presentation. We'll Zoom them in via video conference for that presentation. But if there's any interest, I'll certainly send that out to the board members as well if you want to Zoom in or participate. Happy to have folks sit in on that. So we're going to hit this pretty hard again next year. As you know, we still attain the standards, so we're okay, we think, for another year or a couple of years. But given our population growth, economic growth, this is going to continue to be an issue, so we're going to stay on top of it.
Andy, if I might interject.
Yes.
Additionally, I think the nature of that inquiry is also for this council to be proactive and look at what steps we may or may not be able to take ahead of being mandated to take those steps to avoid that economic impact to our region. And that's pretty aggressive, but it's also, do we want to hit non-attainment, or do we want to forestall that a little bit by adopting some of the non-attainment measures prior to hitting non-attainment voluntarily? There's no reason we can't hit some of those measures and try to forestall some of those non-attainment designation and keep our air quality better voluntarily.
Well said.
Hallelujah. And we may tee up a conversation around this next month as well. Samantha and I have talked about the committee structure, making sure we're getting the right people at the table that can really drive home that message and identify some proactive but voluntary strategies to keep us within attainment. But we need to build up some better muscle memory to really start making that happen. So I think we're going to have a presentation on that next month here at the board meeting. So thank you for that. Third thing I'll mention is got back last night from the Association of Defense Communities Conference in San Antonio, which was awesome. That was my first one that I've been to, is the one that focuses on the installations and their relationship with the community, and really a number of great presentations and conversations. Colorado, I think, had about 40 people there overall, not just from the Springs, but a few from the Denver area as well, but the vast majority were from the Springs region. I know we were represented really well with a bunch of different panel discussions, given the expertise in our community around things happening between coordination with the bases and the community. Just two real quick takeaways, highlights. Had a chance to meet with my counterpart from the San Antonio region with the Alamo Area Association of Governments, and they're doing a lot of really fantastic things in collaboration with the bases, especially around joint purchasing agreements and service agreements and things like that, things that are really saving the bases a lot of money, helping to support local businesses and all that good stuff. So we're going to maybe explore some of that going forward. And then secondly, I'll mention that Keith Klain did a great job kind of organizing this, and the Chamber of Commerce as well. But Keith is with the Defense Mission Task Force, and he arranged a meeting with a handful of us with Deputy Secretary of the Air Force on Monday. So we had a chance to really talk about some of the great things happening here with the Build Grant and all the projects that are happening there. We talked about the Northgate project at Peterson. We talked about our joint land use implementation efforts and how that's moving forward. So really a good chance for us to talk about the really, really good stuff happening in our community and the great partnerships that we have with our bases. But great session, and you'll hear more about that.
Great. Any questions for Andy? Okay, I appreciate all that update. Okay, our next and last item is member entity updates. I'll start over here with Yolanda. No. Nothing? Glant? None. Andy? Norman?
Real quick, coming up is the National Association of Counties Legislative Conference. It's in D.C. 4 of us from the state of Colorado are on the Legislative Steering Committee for NACO on transportation, and I'm one of them, and Holly Williams from El Paso.
Nice.
This is the second one. I'll be introducing a national resolution for proposing authorization of P3, public-private partnerships for rest areas on interstates. Any rest area built after 1960 is not permitted to have a public-private partnership by law. Many of us have already coordinated this through CDOT. John Besados was helpful in getting some language together, so I'll be introducing that at 9 o'clock on February 29th at NACO.
I love that.
Yeah. So
Thank you for sharing that.
You're welcome. Stay tuned. And then finally, if you've got a free weekend, come up to Cripple Creek. It's the last weekend of our ice festival. A lot of fun. Fortunately, the temp's been cold. It's about 15, 20 degrees colder in Cripple Creek than it is here today. So,
what happens at this ice festival?
So these are ice sculptures that are as big as this room.
Oh.
Some of them you can climb on. I mean, slides, and they're, I would say, interactive with ice, but they're a lot of fun. Some of them they're lighted at night, and you actually see the carvers out there with chainsaws, and it's just a fun event. Come up and see on this coming weekend, so last
Awesome.
weekend.
Thank you, Norman. Turner? Military installations, already gave your update. Karen? John? Cammie?
Also, to follow on to Commissioner Steen's comment, I will also be attending the NACO Legislative Conference, and I am moderating a panel on homelessness and how communities are working together really across nonprofit organizations, different municipal and county entities. So basically, this is maybe an all call for any other information. I do have the Colorado Springs report. I'm in touch with Andrew on that and several other, but particularly maybe Fountain, and I don't know if the military installations are having any interaction with the homeless community, and particularly maybe ending veterans homelessness. I think the conversation may go that way a little bit too. So I'd love any information you have that will help me better kind of guide the conversation. And I'm looking forward to it.
Great, I appreciate that.
Just real quick, the El Pomar Foundation, the Regional Pikes Peak Council, has picked up veterans homelessness as the #1 issue to address this year. So there's been some research. I don't know if you've been talking with El Pomar. I'd be glad to connect you.
That would be great. Thank you. I do. So one of the panelists is actually Dr. Robert Marbut, who is now the head of, was a presidential appointee to the kind of an, I can't remember what it's called, ICHS. It's a whole new federal department, really, that is coordinating across departments, kind of breaking down the administration silos. And they have as a specific initiative also to end veterans homelessness, and there are 4 states in the nation who have done that, and a handful, maybe 25 cities or counties who have done that. And I would like the Pikes Peak region to be the next one listed on that list as well. So,
Hear, hear.
Thanks.
Okay. Anything else, Andy? Sharon?
I know everybody's really aware of it, but we do have the young man who lives in the county right east of Fountain Gun. I just lost his name. Garrett, what is his name? I just lost it.
I know.
Okay. I don't want to say his name wrong. Anyways, he's in the news. His picture's out there. Please be aware. And, if anybody comes across any information, desperately needed.
Great. Thank you. Dick? Okay. Our meeting schedule, I think we all know that. I think, thank you for coming here today and helping bring communities working together. We are adjourned.